started as I was sitting at dinner, and it was hard to breathe. And then that pain went to my chest and to my left arm. Those, for me, that are the symptoms that I've always heard of for a heart attack. But when my husband said, "You're having a heart attack," I said, "No, women are different."
Well, at first in the emergency room, they were just giving me tests and trying to determine if, I was in fact having a heart attack. 4 of my arteries were blocked, or 80-some% blocked, and a couple over 100% blocked. So then they said I had to do open heart surgery, and a quadruple bypass was the result of that.
Something in my throat was sore, almost a burning sensation. They suggested I have a stress echo test. Probably 6 minutes into the treadmill part of it, they noticed the EKG wasn't looking good. So they went into the cardiologist, and he called me into the office, and I thought he was going to congratulate me. "Hey, great job, good run." But he said, "No, Jim, we need to see you tomorrow morning at 6 o'clock because we're going to do a angiogram, take a picture of your heart." And he said, "We have some blockage there in some of the arteries, bypass surgery."
Well, I called my doctor to get in with her to see what was going on, and so I went down there, and she checked me all out, and the EKG was running fine, but then she said something in her gut told me that I needed to come to the hospital. They did a CAT scan, and they found out that I needed to be up in ICU, and that's the last thing I remember. You're going to need a quadruple bypass. You're going to need surgeries.
I came here because I had a congenital heart valve defect, aortic valve, and I came here to get it replaced. It was a phenomenal experience. I couldn't have, for open heart surgery, to come in on Monday and be discharged on Friday was just great.
Our program here at SkyRidge covers all types of services for our cardiac patients. From the time they walk in the emergency room, from if they have to have any type of emergency care, we're 24/7. We have a fantastic cardiac rehab program that helps them after their interventions, after their surgery, and gets them back to basically, back to where they were prior to their event.
Well, what impressed me the most up on the cardiac floor was the personal care. The simple fact of coming in and touching the patient, asking questions, asking about my family and what was going on, making that connection. The personal connection is what moves healing on forward.
Cardiac team was awesome, and then the people that took care of me after surgery, in the recovery, they were just amazing people.
The team that we built here at SkyRidge is a very integral part of the whole philosophy at SkyRidge. So we work really closely with the cath lab, with the nurse practitioners, with the physicians, and then we see the patients through after they have surgery, where they are up on the heart floor, and we work with the nurses there, the nurses in the ICU, and we see them all the way through till they come to rehab, and then we get to see them here as well.
Women, as moms, as wives, we're taking care of everybody else first. We really need to take a step back and look at ourselves and take care of ourselves, listen to our bodies, be aware of what can happen, be aware of how you can be your best self so you can take care of those other people. Take care of yourself first, eat right, exercise, go to the doctor and get checked out, and just know that you are healthy.
That I found myself maybe over-exercising a little bit, and that's not the way to do it. I learned, gradually ramp up to protect the heart.
Initially you don't even drive yourself to rehab, but then, it got to be part of the whole routine. You get to drive yourself. It was like growing up again. And truthfully, that type of mental as well as physical exercise was fantastic for both my wife and myself and my sons.
We handpick all our nurses, all our staff that are involved in the open heart program, in all the cardiac program, and we assure their skills are at the top of the line in all aspects.
I can't say enough about the individuals, and they all work together as a team to help every one of the people, because everybody has a little different mindset coming in. And I think, again, some people struggle with the psychological side of it, and I think that's where the team can really help, as well as certainly on the physical side.
they have people that have actually gone through the heart surgery before, and they come in and talk to you before you even do the surgery. And it helped a lot from what, to gain the knowledge for what he made mistakes for. I gained when I was in recovery, and it helped me a lot. So, hats off to all those people that volunteer and come in and do that for the heart patients.
Since I've had the heart surgery, I've climbed 3 14ers, downhill ski, backpack. Everything's back to even better than it was.
You have to ask yourself, how valuable is your life to you and to the loved ones around you? Preventative maintenance for your body is key to me.
I lost 160 some pounds since the surgery. Now I feel a lot better losing all that weight, and I feel a lot healthier, and I work out more. I never did work out that much before, but now I do. So, and I have SkyRidge to thank for that.
That's the advice I want other women to have, that I have to take for myself. Take care of yourself. Go to the doctor. You don't want them to say, you should have come sooner.